Then she carried on doing her postgraduate diploma in hospital management and currently pursuing in PhD in physiotherapy. Her expertise is on women's health, especially in PCOS and in incontinence. Today, she'll be talking about the physiotherapy aspect and its importance in treating PCOS. It's an honor to have you here, Ms. Jancy, and welcome.
So, good morning, everybody.
Good morning, Ms.
Okay, so can we start um, with a brief introduction about PCOS? Let me start my session. Okay, so today you will be seeing about brief introduction about PCOS, then how this PCOS is affecting our body, and how exercises can help us to reduce this PCOS. Okay, so I'm not going in depth about this PCOS because already we had an eminent speaker on this for the past 1 hour. So this is a condition that will be affecting women during her childbearing year, or we can also say like during her fertility period. So what happens is like normally every woman will be having the male hormone, but people who are having PCOS will have an increased amount of this male hormone, which will cause imbalance in the hormonal cycle, and that will be causing a lot of menstrual problem. So because of this issues, there are a lot of symptoms. So the collection of symptoms will be leading to a condition called PCOS. So I'm not going in depth about this. So prevalence also, if you see, there will be around 2.2% to 26.7% of women who has PCOS during their childbearing year. But more than 70% of women are going undiagnosed. That means the prevalence may go very higher in case if we diagnose all the women. So we will just directly see how this is affecting the body and how exercise can help them to overcome this particular issue. So there are two problems uh, that this PCOS persons will be having. One is excessive testosterone level. So this excessive testosterone level will lead to changes in the hormonal cycle, and that will be preventing ovulation. So that will be affecting the fertility. That is one part. The other part is this people will also have insulin resistance. So this higher amount of insulin resistance will lead to abnormality in the blood sugar level, and this also will lead to obesity and other problem, which will be leading to indirectly will be leading to infertility. So how like this excessive insulin will be leading to a lot of these symptoms like reduced fertility, irregular periods, excessive hair growth on body and face, less hair on your head, and changes in the skin, another thing. And not only this symptoms, like when the particular person is diagnosed with PCOS, definitely they will be going into depression and anxiety. So most of the time, rather than the problem creating the issue, the diagnosis will lead to increase in the issues. Like after diagnosing, the people will undergo depression and anxiety. This depression and anxiety will increase the stress level, which indirectly again will be affecting the hormonal levels. So how like in this, if you see, there are two cycles in this PCOS. One is PCOS will be leading to increase in the testosterone level. This increase in the testosterone level will indirectly lead to insulin resistance, and this insulin resistance sometimes is also because of obesity. So there are two different cycles. One is either PCOS will lead to obesity, and this obesity again will lead to insulin resistance, and in this insulin resistance will lead to PCOS, or else the obesity will lead to insulin resistance. This insulin resistance will lead to PCOS. So there are a lot of studies stating that most of the PCOS most of the obesity person will have this PCOS problem. So what doctors say is, like in case if we are able to reduce this obesity, automatically we will be able to control the PCOS. So that is the conclusion of many of the studies, especially in 2016. So, as a PT, we will be able to break this cycle. So, physio will be coming into act in this PCOS at this level. So, physio exercises will help us to break the cycle at the obesity level. So, once we give exercises and reduce the obesity, automatically that will improve the metabolic and endocrine aspect of PCOS, which will be where we will be able to control this PCOS. Is that clear? So there are studies that is showing that if obesity is not controlled, even the treatment given to PCOS will not be so effective. So that's why when a woman diagnosed with PCOS, if she is going for fertility treatment, the first treatment the doctor gives is to reduce the weight or to control the body weight. So VPT play a major role in breaking the cycle of this PCOS. Okay, so we will see how or what are the exercises that can help to break this cycle. So the first thing is, like, there are a lot of studies showing that exercises will help you to reduce the body weight, especially abdominal fat and insulin level. So once you control the abdominal fat, automatically the insulin level also will be controlled, by which we will be able to control PCOS. So there are a lot of studies which is showing that when we reduce the body weight from 5 to 10%, automatically we will be able to restore the fertility and control PCOS. Okay, so I'm not going to give much about this. I'm directly going into the exercise part. So, what are the exercises we can give for the people to control this control obesity, by which we will be indirectly able to control PCOS? So, there are a lot of studies done to find out a specific exercise, but unfortunately, they were not able to find out a specific exercise. So what the study results are saying is, like, lot of exercise like aerobics, strengthening, high intensity exercises, and interval exercises, like that. Like, it is not a single exercises that is going to help you to reduce this PCOS, but many exercises together as a combination will help you to reduce this PCOS. Okay, so we will see what are the exercises. So mainly we will be seeing about aerobic exercises, strengthening exercises, high intensity interval exercises, core strengthening exercises, interval training, and mind body exercises. So these exercises in a combination will help us to reduce the body weight, and it will be helping us to reduce the PCOS. So what is this aerobic exercises? As we all know what is aerobic exercises. So this aerobic exercises will be helping us to reduce the insulin resistance. So when you reduce the insulin resistance, automatically obesity will be controlled, and indirectly PCOS also will be controlled. So studies have shown that aerobic exercises increase the body sensitivity towards insulin. So this will be again helping us to control the insulin resistance. Okay, so we will see how to do this aerobic exercise. So if you see aerobic exercise in sense, like, the study has proven that minimum 45 minutes to 60 minutes of exercise duration will be helping you to reduce this obesity or reduce the body weight. So in aerobic exercise we have three sessions. That is, we need to have a warm up session, then the core aerobic session, then the cool down session. So usually this warm up session and the cool down session will be more of stretching exercises and will be more of active exercises. So warm up and cool down is to make our body uh, ready for the exercises or make our body flexible for the exercises. That's why during the warm up session we go mainly with active exercises and stretching exercises or flexibility exercises. So in this total 45 minutes to 60 minutes of duration, nearly 15 minutes will go in warm up and cool down exercises. Remaining 30 minutes will be the 30 to 45 minutes will be the core exercises uh, that we are going to do. So this core exercises can be of the like can be with the individual's liking. So they can go for cycling, they can go for jogging, brisk walking, aerobic dancing, zumba, or swimming, anything you can do. But only thing is you need to do for 30 to 45 minutes of duration. So anything lesser than that will not be having that much of effective. Then another thing is regarding the intensity of exercises. So whenever you are a beginner, you need to start with moderate amount of aerobic exercises, then slowly go towards the severe severe intensity of exercises. So how to find out this moderate intensity? So it is nothing but 50 to 70 percentage of maximum heart rate. So maximum heart rate is nothing but 220 minus your age. So that means if you are 30 years old, 220 minus 30 will be around 190. So you need to do exercise in such a way that your heart rate doesn't go beyond 190. Okay, so this is a rough calculation. So this is how you have to do. Then like this exercises, this aerobic exercises have to be done at least 3 times in a week. That means alternative days you need to go with this aerobic exercises. Okay, so this is the first this is the first type. Then the next one, if you see, like resisted exercises. So again, resisted exercises will help you to reduce the insulin resistance, and it helps you to increase the metabolic rate and improve body composition. That means it will reduce the fatty tissue and it will increase the muscle component. So in this way, it helps you to reduce the insulin resistance. So it will be helping you to dissolve the abdominal fat, and when this abdominal fat reduces, automatically insulin also will be insulin resistance also will be reducing. So this resisted exercises, you have to choose mainly close kinematic chain exercises. So close kinematic chain exercises are nothing but like quads, push-ups, then triceps dips, like that. So rather than doing dumbbell exercises for the upper extremity and the lower extremity, you need to do lot of resisted exercises for the core muscles. Core muscles is nothing but the spinal muscles. So that's how it will be helping you to reduce the insulin resistance. So this resisted exercises have to be done for 10 to 15 minutes. That means like resisted exercises is usually done 3 times in a day, and one set will be consist of 10 to 15 times. So if you're doing quads, you need to do 10 to 15 times of quads, then give few seconds of rest, then again you can go for again second set of squats. So if you're not able to do squats continuously, you can also go with the sequence. So first squats, then push-ups, then go for the lower, like that. So you can also go with the circulation. So this is called as circuit training. So you can concentrate spine, upper limb, lower limb, then again spine, upper limb, lower limb. So this will help you to give rest to the particular body segment, and this will also help you to go for the exercises continuously. Again, this resisted exercises have to be done 3 times in a week. So again, it is alternative days. So research has shown that combining resisted exercises and aerobic exercises will be giving you a best achieving, will be reducing your BMI drastically. So that means like a person have to choose aerobic exercises and resisted exercises, and they have to do alternatively so that they can achieve the desired body reduction in the body weight. So next is regarding the high intensity interval training. This high intensity interval training, again, it will increase your cardiovascular fitness, and this also will reduce your waist circumference. So this will be involving uh, very high intensity of exercises with a short duration of lower intensity exercises. That means you need to go for a jumping jacks or mountain climbing, like that, a burst of activity you need to do. Then you need to go for a lower intensity recovery exercises. So it should be like an alternative, a very high intensity exercise, then a lower intensity exercise, then again high intensity exercise, and again low intensity exercise. So this will drastically act on your abdominal fat muscles, and this will be also helping you to reduce the waist circumference, which is very very important for controlling PCOS. So research has shown that this high intensity interval training will be more effective than aerobic exercise, also than aerobic exercise or than a brisk walking in reducing the body weight. Okay. So next is core strengthening. So this core strengthening is nothing but strengthening your core muscles, that is spinal extensors, flexors, and the pelvic floor. So this is very very much important to prevent injuries. So whenever you're going for exercises, mostly this PCOS, the exercises have to be done for a long period of time. So you cannot just exercise for a week and just leave the exercises. You have to do for a very long period of time. So during the time when you are going for very high intensity exercise, sometimes you may injure your ligaments or injure your muscles. So to prevent that, this core strengthening exercises will help you to reduce the injury prevention. So this core strengthening is nothing but you need to strengthen your spinal extensors, flexors, as well as the pelvic floor muscles. So this also will help you to prevent incontinence. It will help you to boost your sexual life. Then it also gives you a good support in during your pregnancy, that is in the later part. So next is interval training. So interval training is nothing but you have to mix and match the exercises. So you have to do a little bit of low intensity exercise, little bit of high intensity exercise, little bit of aerobic exercise, and little bit of strengthening exercise. So this different exercises with proper interval is the interval training. Okay. So next is body mind exercises. So body mind exercises is to relax yourself. So basically, if you see, this PCOS will be leading to a lot of stress and depression, as I said early. So once the person knows that they have PCOS, automatically they will go into depression, and this depression will lead to stress. And in other way, if they have infertility, that will lead to stress, and that stress will again form as a cycle, and it will be increasing the PCOS effect. So you need this body mind exercises. This is nothing but psychological relaxing exercises like yoga, pilates, and tai chi. So these three, it also helps you to reduce the calories, but more than that, these three exercises will help you to control your stress level. So once the stress level is controlled, automatically PCOS, indirectly it will also control your PCOS symptom. Okay, so this is the last exercise. So we have seen nearly five different types of exercises, which uh, we have to combine in a proper sequence, and we have to make it as a regular routine. Okay, so once we make it as a regular routine, this definitely will be leading to minimum of 5 to 10% of body weight reduction, which will be increasing nearly 20% of fertility, 20% of fertility chances. So a lot of research support is there to prove that nearly 30 to 60 minutes of exercises of any combination will help you to reduce the symptoms of PCOS. And majorly, since this exercises you need to do for a very longer time, you need to choose the exercises which according to your likings, or just to reduce the boredom, you can mix and match of this exercises with any of your uh, combinations. So for example, people who like to go for swimming can choose more of swimming exercises, or can choose more of water activity exercises. People who like to go for cycling can choose of more activities towards that. So since you need to go for a very long period of exercises, you need to choose a good combination of exercises which will help you to do the exercises for a very long time. So I have just made a simple exercise plan uh, with a combination of these five exercises. So you can create any one kind of this interval training session that will be helping you to combat this PCOS. So first, we can go for lower interval training sessions with the squats, jumping jacks, lunges, biceps curls, and crunches. So this is like majorly core strengthening exercises, and it is also your, it can be also your lower intensity exercises, and when you do it at a higher intensity, it will be also like your high intensity exercises. So for initial, for 5-10 minutes after your like warm up, you can go for this kind of exercises. Then go for 30 to 45 minutes of aerobic exercises. Aerobics can be walking, jogging, swimming, running, or like treadmill, anything. Then again, you can go to a aerobic class or a gym, or you can also go for dancing, aerobic dancing like zumba or anything. So that also you can choose instead of this walking and jogging. Then you can also go for this hit, that is high intensity exercises. Usually you can go to a gym to do this hit, or if you prefer, or if you have a good knowledge, you can choose a good YouTube video, and you can follow the YouTube video for this hit exercises. Then lastly, you have to end up with pilates or tai chi or yoga. So that will be helping you to relax your mind. So uh, you should not do all the exercises in a day. So this should be like a combination of either little little, or you go with alternative days. So this is about the exercises to reduce or control this PCOS. So next is how to prevent this PCOS, because like the world is going towards obesity. If you see, the percentage of obesity is beyond control and beyond imagination. So especially adolescent obesity or childhood obesity is increasing drastically. So we need to reduce the childhood obesity to prevent PCOS in their later days. So that's why we need, that's how we will be able to prevent PCOS. So first is, even from the childhood, we need to, we should be able to maintain a healthy weight for the babies. So even like it starts from 4 years or 5 years. Don't think the baby should be so fat and chubby, or they should be like the body should be like a round, like don't expect such kind of babies. So you need to see, like you need to check their BM, like you need to see their desired weight according to the age and the height. So it is not mandatory that the baby should be chubby and always should be a plumpy one. So because this childhood obesity will later lead to a lot of adolescent problems like PCOS. So try to maintain a healthy weight from the childhood. This can be done by play therapy. Allow the kids to play outdoors rather than playing indoors. Then maintain a healthy eating habits. So don't give junk foods. Don't try to eat a lot of junk foods. Rather go for good healthy habits, like a lot of proteins, a lot of cereals, like that. Then maintain an active lifestyle. Like maintaining active lifestyle means definitely you need to have a exercise session in your day, and don't sit in front of a system or a mobile or a TV for more than half an hour. Every half an hour you have to get up, go for a small activity and come back. So that's how you will be able to maintain an active lifestyle. Then healthy lifestyle means quit smoking, quit alcohol, all these like quitting bad habits will be your healthy lifestyle. So these are the things will help you to prevent PCOS from the initial stage, or from the initial stage. Okay, so at the end, why we are talking so much about this PCOS means because it leads to infertility, and this infertility is not a simple things. It leads to lot of economic and psychological issues in the family. So economic means like it will be having a, major impact. That is the infertility treatment is will be creating a major impact in your family life. So it will be taking up lot of amount, like it will be using up lot of your valuable savings. So that's why we need to create the awareness about this PCOS at a very early age, so that we can reduce this infertility, or we can control the infertility problems. So exercise definitely helps you to control PCOS, and it also will be helping you to increase the fertility chance. So nearly, if the women is able to maintain the body weight, and if the women is able to reduce the body weight at least 5%, then the chance of getting fertility will be increasing to 80% of 80%. So that's how exercise plays a very major role. So I hope you got an idea how this exercise is helping you to control PCOS and leading to a fertile life. So, any questions?
Thank you, Ms. Jansi, for an informative presentation on the physiotherapy management of PCOS. Now we'll move on with the Q&A session, and I will start the Q&A session before opening the floor to the audience. Ms. Jansi, my question is, a new genetic evidence has revealed that men can also develop PCOS-like condition. So what will the physiotherapy management like, or is there any difference in the physiotherapy management for a woman and male?
Actually, like from the exercise point of view, there is not much difference. Only thing is like we need to break the obesity, or we need to reduce their body weight. So if they are able to maintain a healthy body weight using the exercise, automatically the remaining things will be able to control. So this is from the exercise point of view. There is not much difference. So they can also follow the same thing. Majorly, they have to control the abdominal fat. So the abdominal fat only will be leading to a lot of issues like obesity as well as the insulin resistant. So once they control this abdominal fat, the insulin resistant problem will be under control. And not only that, their chance of getting diabetes will be under control. Again, this diabetes is also another reason for infertility. So that problem also will be under control.
All right. Thank you, Ms. Jansi. Is there any
So
questions
again,
from the...
another thing is
Sorry.
like it is not. I don't say that only exercise can help you to reduce this PCOS. So again, it is medical and the physical management both together goes hand in hand.
Okay. Thank you, Ms. Jansi. So the question from the audience, one of the question is, sorry, how fast can we see the result of exercise? And what weight in percentage or BMI will stop PCOS cycle in a person?
Okay. So, like, yes, PCOS doesn't mean that all the PCOS patients should be obese. So, there are PCOS persons who will be very thin, but still they will be having this problem. So, they can go with high intensity exercises rather than aerobic exercises. So, this high intensity exercises will help them to reduce the insulin resistance and reduce this PCOS problem. So people who don't have obesity, they can choose more of high intensity exercises rather than aerobic exercises.
Okay. Thank you, Miss. Another question is, what are the suggested exercises for lean PCOS women,
So
and do they also focus on weight reduction?
yeah, that's what I explained. So
Mhm.
people with lean PCOS, without obesity, can go with more of high intensity exercises rather than aerobic exercises. So they can go with, like, the time duration can be little lesser for them. So they can go for, instead of the 60 minutes of aerobic exercises, they can go for 15 to 20 minutes of aerobic exercises and more of high intensity exercises. So this will help them to combat the insulin resistance. And the next question is, like, for irregular menstrual cycle, of course, if you follow a proper combined exercises, like 3 days in a week if you go for aerobic exercises, and another 3 days if you go with high intensity exercises, definitely you will be able to control the problem, and you will be able to have a normal regular cycle.
And another question
Yes,
here,
and
is it normal?
the
Yeah.
last one is normal bleeding. I think Dr. Jaipal will be able to answer this. As per my knowledge, there are chances of spotting during exercises in PCOS patient, but I would like sir to explain this more.
Question is it no is normal bleeding while doing exercise for a person diagnosed? I haven't got the thing of the question.
I
Is
think
normal bleeding while doing exercise for a person diagnosed? Or what is the question?
maybe like
I,
they can.
I think the question is like, while performing an exercise, is it normal for a person to bleed? Is it normal for a person who's
No,
diagnosed
no,
with PCOS
no.
to bleed?
Actually, like, during exercise, they don't bleed. It is not normal to have. In case if they have any bleeding whenever they are doing exercise, then definitely they need to check gynecologist and get any other test done.
Okay. Thank you, Dr. J. Paul and Ms. Jancy. Is there any questions from the audience? Yes, Ms. Rabiato. Ms. Rabiato, would you like to switch on your, unmute your microphone so you can ask your question? So the question here is, I'm the diagnosed PCOS patient and had started constant exercises since December. Is it normal if got stained afterwards? That's the question.
Uh, Actually, like, after high intensity exercises, there is chance of getting spots. But in case if you are getting a bleeding kind of like a flow, then definitely you need to check with the doctor, because there is no chance of getting a bleeding like as a flow kind of bleeding. So there may be a spotting like now and then, but even spotting also, it should not be, they normally they don't have a regular spotting. Once in a while they may have a spotting.
All right. Thank you, Miss. And there's another question here also in the chat box.
Yes,
Two
like
questions.
even if you are underweight, still you can go with exercises, because like that's where your strengthening or resistance exercises will act. So your resistance exercises will help you to build up the muscle mass, and this will be helping you to maintain the body weight. Okay, so still people with underweight can do exercises, but can reduce the aerobic part of exercises and increase the other part, like increase the strengthening and the high intensity exercises. So that's why PCOS is not only because of obesity. There are a lot of other reasons for PCOS. So like you may be like wondering, I'm in normal body weight, and I'm doing exercises, and like why I still have PCOS. Maybe you have other cause of PCOS, like maybe like you have a genetical, maybe you have a diabetes, like you can check with the other causes. So obesity is not only the reason for PCOS, so still there are a lot of other causes for it.
All right, thank you, Miss. We will take one last question from the audience. Is there any other question?
Okay, so
Okay.
the last one I just want to add up is, before starting the exercises, please consult the doctors. Then you can start. You should not just start the exercises by seeing a video or by seeing a YouTube. So you have to consult with a physiotherapist or a physiotherapist. It's better to consult a physiotherapist before starting your exercises, because there are a lot of other reasons also to calculate or to design your exercise program. So just like that, from the YouTube, you will not be able to design your own exercise program. And there are some contraindications also. Some people will not be able to do a lot of aerobic exercises. So if they have any cardiac problem, or if they have any other vascular related problem, so so my sincere advice is meet a doctor and a physiotherapist, then you design your own exercise program.
Okay. Thank you, Ms. Jancy, and thank you to everyone for the questions. As we are now coming to an end of the webinar, I would like to thank both the speakers, Dr. Jaipal and Ms. Jancy, for giving an informative presentation on polycystic ovarian syndrome and also spending their Saturday morning with us. Thank you so much, Dr. Jaipal and Ms. Jancy. And thank you to the participants also for spending your time and being part of this webinar. I hope this webinar has enhanced your understanding more about the PCOS. And once again, I would like to thank the UPSA committee for organizing this event for us. Thank you. So before we end, if you don't mind, can we have everyone to switch on or turn on your video so we can have a group picture taken? Sorry, there's technical problem, so I think we have just wait for a few seconds. Yeah.
Hi everyone, I'm in charge of taking the photo. So we have 6 pages here. So I need to take 6 photos, and please everyone look into the camera and smile so I can take the photo, okay? So for the first page, everybody please smile and on your camera. 1, 2, 3. Fotonya one more time for page 1. Please smile. 1, 2, 3. One more time again for page 1. 1, 2, 3. Okay, moving on to page 2. Please smile. 1, 2, 3. One more time for page 2. 1, 2, 3. Okay, page 3. Please look into your camera and smile. 1, 2, 3. One more time for page 3. Okay. One more time for page 3. Please look into the camera and smile. 1, 2, 3. Now for page 4. Page 4, please look into the camera and smile. 1, 2, 3. And finally, page 5. Please look into the camera and smile. 1, 2, 3. Okay. Apparently, there are only 5 pages, so I will send the photos into the webinar WhatsApp group later. Thank you all for owning your camera and joining us today.
Thank you so much once again. And also these pictures will be posted on our UPSA Instagram page. And e-certificates for participation will be given in 2 weeks' time. Yeah, thank you so much. Thank you, Dr. J-Paul. Thank you, Ms. Jancy, and thank you for the participants. And have a great day ahead. Thank you.
Thank you, sir.
Thank you, Dr.